everybody for joining us today for Children's Health in Focus. Conversations we're holding with experts on timely and important health-related topics. I'm Arturo Brito, President and CEO of Children's Health Fund. I'm also a community pediatrician with a public health background, coming to you live from our broadcast room in New York City. Today's topic is public and private efforts to safeguard the mental health of America's children and youth. Children's Health Fund was founded more than 35 years ago with a vision that one day all U.S. children will receive the health care they need and deserve to thrive and succeed. We lead a national network to bring comprehensive health care to children growing up in under-resourced communities. We translate lessons learned on the ground to advocate for the health and well-being of all children. From our central office, we develop innovative programs and roll them out to our 25 partners in 15 states, Puerto Rico and DC. And our national partners deliver services to children where they live, learn, and play through a fleet of more than 50 mobile medical clinics, telehealth, and at more than 400 schools, homeless shelters, and other community sites. When we say comprehensive healthcare, this means medical, oral, mental, and social services in an integrated fashion. We understand that you cannot separate mind and body. So in the 21st century, it's really impossible to have a discussion on youth mental health without focusing on social media. In the words of U.S. Surgeon General, Dr. Vivek Murthy, there are ample indicators that social media can also have a profound risk of harm to the mental health and well-being of children and adolescents. Let's start with the fact that in this country, social media is universal, with nearly 95% of youth 13 to 17 years old using it, and 1 in 3 use it almost constantly. In recent months, several reports and advisories have been issued detailing a mental health crisis affecting America's children. These include that between 2011 and 2021, the number of teenagers and young adults with clinical depression more than doubled. The suicide rate for teenagers nearly doubled between 2007 and 2019, tripling for those 10 to 14 years old. In 2021, 1 in 4 teenage girls made a suicide plan. While this mental health crisis can be attributed to several factors, including the COVID-19 pandemic, gun violence, and climate change, social media is also part of the problem, yet offers an opportunity, which you're going to hear more about in a few minutes, to mitigate harm to America's children and youth. I'm honored to be joined today by Dr. Jenny Radesky and Mr. Pernell Bryce. Dr. Radesky is a developmental behavioral pediatrician at the University of Michigan Medical School. She's also co-medical director of the American Academy of Pediatrics Center of Excellence on Social Media and Youth Mental Health. Mr. Bryce joined Children's Health Fund in December 2022 as Vice President of Policy and Advocacy. He brings years of experience working in this area, and in the short time he has been with us, is already making an impact on the well-being of children across the country. Jenny and Pernell, welcome, and thank you for being here today. We're so honored. Before we jump into the discussion, there's 3 housekeeping items I want to share with our audience. Number 1, please keep yourselves muted throughout to avoid any background noise. If you have questions, please post them in the chat. I'll be monitoring them throughout the session, and we'll get to as many as soon as time permits. And we'd also like your feedback. Toward the end of this discussion, there will be a link to a survey in the chat. We would love to hear from you through that link. So, Jenny, let's start by having you describe the social media landscape and what we know about the impact on youth, and also tell us a little bit about the Center of Excellence on Social Media and Youth Mental Health that you co-direct, how it came about, the goals and current projects.
That's great. Thank you so much. It's great to have the opportunity to talk about this new center. It's run through the American Academy of Pediatrics. I am co-medical director along with Megan Moreno from the University of Wisconsin School of Medicine and Public Health. It was just funded this past year through SAMHSA, the Substance Abuse and Mental Health Services Administration, through the Department of Health and Human Services. So it's this really great opportunity for us to create a centralized source of resources, training, and guidance on this very tricky topic to youth, caregivers, clinicians. We're going to train teachers, anyone who supports the health and development of children and teens. Next slide, please. But the thing that is crucial as we're starting to construct resources and guidance for families is that our approach needs to reflect the nuance in the research science on this topic. I'm a researcher. Dr. Moreno is also a researcher. We both understand that it's not an easy, just take their phones away, take social media away solution. I'm just showing this slide because it's one survey conducted in teens and young adults in the United Kingdom. It's not meant to represent the hundreds or thousands of studies that have been done on social media and youth mental health, but I'm showing it for two reasons. First, we can't treat social media like it's a monolith. Every platform, like here, they talk about Instagram, Snapchat, Facebook, Twitter. It has its own design features. It has its own algorithms. It decides what to elevate, what to recommend. It has its own content policies and different ways that those are enforced. They all have different business models as well as advertisements. Okay, so this is only 4 of these platforms. This was all pre-TikTok, pre-Discord, all these other platforms that our kids use. So one thing that's important to understand is the unique qualities of these different platforms interact with kids differently. And every kid is unique and an individual who has strengths and weaknesses that may be a good match or may be a poor match for different platforms. So you can see that Instagram, which is very visually oriented, lots of photos, lots of videos, teens rate it worse for their body image, but better for their self-expression. Twitter, where people love it, just, tweeting about stuff, they rate it great for their self-expression, but not so great for real world relationships. And none of these are rated well for sleep, right? So there is pretty good evidence that how you use social media in the nighttime hours, using it compulsively or just to kind of vent your negative emotions is not always the most healthy. So I do want to make one policy relevant comment here because we will be talking about that today. One thing to take away from the nuance in the research is that approaches to policy and approaches to clinical intervention need to be really precise. They can't just be, global bans. We need policy that focuses on the designs of these platforms, the data collection, and the business practices, as well as accountability, so that the tech industry is making sure that kids have a better balance of these blue rectangles compared to the red rectangles. Next slide, please. Another really important concept that stems from the nuance in the research and our work as pediatricians at the center is we understand the lived experience of kids who are going through the mental health crisis right now. So we feel really urgent. We need to help. We need to provide some resources. Families don't know what to do, but we want to avoid reinforcing the big noisy buzz, the dominant polarized narrative about media and mental health. If you could open your phone and find any number of headlines that are telling you how wonderful media is for kids or how terrible it is. And the truth is, it's going to vary in between day to day, child to child, different ages. And we know that really headlines that focus on risk, that focus on fear, they tend to make families feel disempowered and hopeless, which is the opposite of what we want. So what we're going to do with this center is emphasize kids are resilient. They have unique, awesome characteristics that are developmentally adaptive. Okay, all of our kids are really curious about TikTok. They're attracted to novelty. They want to see their peers' reactions. They want to connect with their communities. But right now, the platforms that they have access to are not a great match for all of the nuances of their developmental stages. So what we want to do in terms of the resources we're providing is focus on research that carries that nuance and also centers the youth point of view. Because we also know from our clinical work, if we don't center the experiences of youth from all different backgrounds, we're just going to be another group of adults making up rules that kids may not follow. Next slide, please. So here's the 5 elements of our new framework that we are going to try to build into everything we do through the center. One is to really center kids and their emotional experiences, their self-regulation, their growth, and how they can have agency in the digital world, meaning be intentional about its use, engage and disengage when they want to, not feel like they're sucked in or taken down a rabbit hole. We're going to take a developmental lens because relationships with social media and mental health don't start in adolescence, they start in early childhood. And so we're going to start with some resources for families with younger kids as well. The importance of context is really crucial because social media and tech don't occur in a vacuum. They're shaped by social, family, and cultural forces, as well as families, the parents' use of technology. So we're going to have resources for parents as well, how they can get better balance. We know as pediatricians that kids are all different. So we need to take into account the fact that kids are diverse in terms of their neurodiversity, their racial and ethnic and cultural diversity, their gender diversity. So all of these characteristics shape how they use social media and how it shapes them. So we want to have resources that are a bit more flexible and not one size fits all. And then finally, we're really going to focus on digital ecosystem design and pointing out the fact that most large platforms popular with kids were designed by adults who don't know a lot about child development, and they were designed for adults. So with different assumptions about who the user is and how they're going to use it, not around child needs or the unique ways they see the world. That's an important thing when we'll talk about policy as well, is kind of following more child-centered design. So we're excited, I'll wrap up here, but we're excited to have the opportunity to really take a fresh and family-centered way to create resources, answer questions, as well as work with the Youth Advisory Council and a tech expert panel that includes some industry representatives. And hopefully through these multiple stakeholders, improve the experiences of young people online. Thank you.
Thank you, Jenny. There's so much information here, and all of it's so relevant to our discussion about the potential impact of social media on the mental health of children. But however, you're focused on kids being resilient and opportunities here to actually turn it the other way around and make it positive. I also like the fact that you emphasize how, just like clinical practice, policy needs to approach to it has to be precise. And I think that's a good transition to Purnell. As the Vice President of Policy and Advocacy here at Children's Health Fund, Purnell, I know you've been doing a lot of research in this area because of an interest that you and the fund have. Maybe you can describe some of the policies or key legislation that help address this issue of children's mental health as it relates to social media, and some of the pros and cons of the policies that you're reviewing.
Sure, happy to do that. Given the alarm and a lot of the stress that parents and communities are experiencing throughout the country, we've seen a number of legislative movements from the state and federal level. California was actually the first state to pass legislation around this issue to safeguard minors online. Their law will go into effect next year, and it will force tech companies to protect children's mental and physical health by defaulting to various privacy and safety settings. Aligned with that, Arkansas and Utah actually passed legislation as well that focuses on those same issues, but also looks at verification, ensuring that, minors are verified, and then also that parents have different support in terms of monitoring and measuring their youth's access on social media. On the federal level, S 1409 has been advanced by Senator Richard Blumenthal, and so that's an amazing piece of legislation that has received strong bipartisan support. It requires social media platforms to not only protect minors by disabling addictive information, and also disabling as we all know, these algorithmic recommendations that are, serious pitfalls. And so they also give parents, some power to control, when their students are online, when their children are online, and how often they're online. In addition, we have the Children and Teens Online Privacy Protection Act. That was advanced by Senator Markey. He's also the author of similar legislation that came out in 1998. Senator Markey and also his co-sponsor, Senator and Dr. Bill Cassidy, they advanced this legislation. Another important piece is that this information would not allow children under the age of 18, really focusing around 13 to 16, prohibiting internet companies to collect any information from this demographic. It also would ban targeting minors from this age demographic as well. But I can also share, we do have some positive news today, is that both of these bills have been voted out of the Senate Commerce Committee, and now they will move forward for a full Senate vote. And so we're really excited about that. It shows that at the federal level, our legislators are really listening to communities, listening to their colleagues on the state level, and are doing something positive to support parents, but most importantly, their children and our youth.
Oh, wow. Thank you, Pernell. I think it's refreshing that a lot, if not most or all of these bills have bipartisan support. There's bipartisan interest in this area, and it's really about protecting the mental health of children. So, Jenny, I want to ask you, maybe you have some thoughts on some of the comments that Pernell made in some of these bills, and just see what you think.
Yeah, and I want to preface by saying that our center does not endorse any specific bills just because we are funded by the federal government, but we do, have opinions about the types of like the ingredients in legislation that we think would be most helpful. When it comes to data privacy, like included in COPPA 2.0 or the California Child-Centered Design, Age-Appropriate Design Code, what that means is that these invisible data traces that kids leave as they're watching videos on a feed, playing a digital game, searching the internet, they aren't used to create a profile with inferred characteristics. Oh, this teenage boy really likes looking at these sorts of, sexy photos online. Maybe I'll send them an ad for something a bit pornographic. Oh, this, teenage girl seems to hover quite a lot or click on these sorts of images that have more body image connotations. Maybe she's dieting. Maybe we should send her some dieting ads. These inferred characteristics about what our kids are going through emotionally is not really a fair fight for an adolescent or preteen who is starting to understand, who am I and how do I want to interact with the world? And part of that is done through these social media platforms. So they're leaving all these traces that companies can collect about them to say, aha, who is this user and how am I going to send them things? Research has shown that companies have made advertising profiles about teenagers that say, oh, this one might be interested in online gambling, which is not legal for teens to be doing. This one might be interested in pharmaceuticals, which means they may get some, solicited for ads for marijuana or other sorts of substances. And as pediatricians or other advocates, we think we'd like to help these kids who might have a propensity towards some of these difficult experiences during adolescence. We'd like to help them learn other ways of coping, learning to accept their bodies, learning how to calm down without needing substances, learning how to handle their emotions in a way that doesn't just get kind of exploited for advertising purposes. So that's the importance of the data privacy piece. Kids can certainly still search for things they're interested in. They could say, I'm interested in being sent ads or content in my feed about these different topics. It's fine for a child to say, please, I want this. It's not okay for a company to make inferences and send them something. When it comes to the accountability side, that's also really important because it means, currently the internet, social media platforms have been operating in a little bit of a wild west in terms of regulation because there's so much content out there. There's so much being generated by users, by AI now, that it's really hard for platforms to sort out what should be sent to different kids. They have content moderators who look for really violent, disgusting, child abuse and other sorts of things, but they're not catching some of the milder forms of harmful content that get recommended to kids. So an accountability part of a law would make each company have to keep some tallies and be transparent about the fact of this is how many kids use our service, kids under 18 or different age ranges. This is how many times we recommended a piece of content that had self-harm in it or had some other negative source of content, had bullying, had something that was racist in it or had hate speech. They would be keeping track of all that, monitoring it, being more transparent about it. No one's going to be perfect. I mean, there's so much content out there, but at least it's some accountability to say we're trying to keep this sort of more harmful stuff out of kids' way. And I think that those two pieces are really important in recognizing when kids are actually using your service instead of making it easy for kids to just kind of make up an age and get on your platform and be treated like an adult.
Yeah. So as you're talking, Jenny, a question came in from Dr. Jeffrey Holzberg, a pediatrician, who's asking, and he's praising the fact that the Center of Excellence focuses on children, which is great. And he's asking, what can we as pediatricians do and say to parents while, about social media with the kids, while also preserving the child's or teen's autonomy? It's that balance, right? So what are some of the recommendations you would make to parents as a pediatrician?
The biggest one we are making is having regular conversations about this. This is such a huge part of might be such a huge part of your child's social experience, the way they experience pop culture, the way they seek information, whether it's information about the world or activism or silliness. Like it's often a really big part of their lives. So instead of feeling intimidated or ashamed of it or guilty about it, just lay the ground for some open conversations. Number one approach that I would tell families, or I do tell families, is kids expect grownups to restrict, take things away, or tell them this is stupid. Why do you kids do this? So changing your language and even your body language when you're having these conversations to say, you're the expert on this. You're the one going through this. Tell me about it. Teach me about it. I have an open mind. I promise I'm not going to overreact. If I think something is dumb, maybe I'll joke about it and you can teach me why it's not dumb. So having that sort of humility and open-minded conversation is really important. It's not going to be one conversation. It's going to be multiple over time so that kids know you can come to me if you see something creepy, scary, upsetting, someone's bullying you. And then as an adult, you're also talking about your own tech use, because we can't be hypocrites, and we need to also say, you know what, I spent way too much time on whatever platform today. I just got totally hooked into it. And I'm going to start setting some limits, or even asking kids, what's one thing you wish you could change about my tech use? And having there be a little bit more of an even playing field so that there isn't this perceived like power differential between us. Because honestly, many of us didn't grow up with all this technology. So we feel afraid of it. We feel like I just need to shut it down. But what we've seen so far is only restricting access sometimes makes things worse, or it closes us off from conversation and understanding of one another. And if there's a crucial ingredient to kids' mental health, it's letting them know we're trying to understand them and that they can come to us if they're going through something tough.
Great, thanks. And Pernell, I know you're a parent. Maybe you can talk a little bit about some of the rules that you're thinking about or already putting in place in your own home. And where that comes from.
And after talking to Dr. Radesky, I guess I have to be more diplomatic in terms of laying down the law. And so as it relates to my wife's social media use. But yeah, my children are 7 and 9, and also children of young girls. And so, algorithmic issues and privacy is definitely something that my wife and I talk about. We also talk about a platform called Roblox. We're actually maybe one of the few families that aren't really on it. And so we just want to learn more about it. And so, I think what Dr. Radesky shared will be very useful as we continue to navigate and explore this issue and talk with other, parents from the same age range as well as they, figure out how to empower, but also to protect their children.
Yeah. So, and I know that you're both aware there's the American Academy of Pediatrics for many years, if not over a decade, has made recommendations about limiting screen time, total screen time, TV, computers, phones, etc. How does that play into it? And what's the general recommendation with that with children?
I mean, I'll make 2 points about this. One is that screen time and social media, the link there is not really strong, because you can spend only 5 minutes on social media and be totally harassed or see something really negative, or you could spend 3 hours on it, laughing with your friends and, exchanging silly content and stuff. So time isn't the best indicator here, but when you're raising a family and you want to have some structure in your day and you want your kids to sleep enough and you want them to do their homework, you do want to have conversations with them about how are we going to structure our day so we're not constantly arguing about access to, YouTube or Roblox or, Instagram. Have kids be part of that conversation. I have a 9 and a 13-year-old. I'm always impressed that when I say, okay, what do you think the rules should be around video game time on the weekends? They actually offer up some pretty reasonable, they're not asking for like 6 hours a day, and so, and if they do say 6 hours, you could say, all right, but what would you miss out on the other parts of the day if you spent all that time with just that one activity? Helping kids recognize all the different things they're good at and that sitting with your phone displaces is really important. And then for younger kids, the time limits and having it at consistent times of day really helps them just internalize a habit and a routine around it, that they get used to there being a time and a place for media. Whereas with older kids, you want to have them be a little bit more a part of like, what do not disturb settings am I going to set? How am I going to look at my screen time output every once in a while and decide if this is a good balance for me, and let them be more part of the problem solving.
Yeah, well, unfortunately, we're just about out of time and I have to wrap it up. My goodness, this flew by so fast. I get the feeling it's not just Pernell. A lot of people, a lot of parents listening right now might be rethinking the way they talk to their kids about social media, which is great. And this is just the beginning of the conversation. I'll remind people that we have a link on the chat for a survey. We really want to get your feedback. So please go to that link and give us your feedback. And Pernell and Jenny, thank you so much for teaching us so much about social media, its potential impact on our children and youth. And I want to thank the listeners and the audience for being here. This work is incredibly important to us here at the Fund. Here we identify the most marginalized children growing up in under-resourced and hard-to-reach communities throughout the country. And we partner with pediatric providers from around the country to bring comprehensive healthcare to those children. And then we then translate under Pernell's leadership what we learn on the ground into informed policy and advocacy so that all children can thrive and succeed. Again, please feel free to reach out to us, and if you have any questions or would like to continue this conversation. And we hope that you'll be able to join us for our next Children's Health in Focus on September 20th at 2 p.m. Eastern Time, when you're going to hear about an innovative initiative where we educate families about vaccines and provide the COVID-19 and other childhood immunizations through mobile health outreach. I'm going to be joined by providers from Dallas, Phoenix, and South Florida, 3 of our national network sites, as well as a guest from the American Association of American Medical Colleges, our partner in this effort. So please be on the lookout for this invitation. And thank you again for joining us, and have a great rest of the week. Appreciate it. And thanks again, Jenny and Pernell.
Thanks so much.